Hi, and welcome to CityWorks, a production of the City University of New York School of Labor and Urban Studies and CUNY TV. I'm Laura Flanders. Each month here on CityWorks, we examine an aspect of the lives of working people on the job, at home, in New York, and in the greater urban landscape. Our program today asks a very important question: COVID recovery and essential workers. What is next? The hardships for working families have multiplied manifold in the past year as the COVID-19 virus challenged us in new ways. In the forefront of all of our struggles to fight the virus and keep critical services going have been essential workers, without whom New York, for sure, would certainly have been stripped bare. This is the show where some of those workers are going to get some airtime to share their experiences. Please hear our thanks and express their needs, wants, and desires for the future. As calls for urban areas to fully reopen grow louder, what's it going to take to keep our essential workers who keep the rest of us safe? Terrence Lane is a New York City bus driver and chief shop steward of TWU Local 100 in Harlem. Transit workers have been through a lot in the last 12 months, and not only from the virus. Nationally, though, 134 TWU transit workers died from COVID-19. Lisa Baum's a public health expert who leads the group on occupational health and safety at the New York State Nurses Association, or NYSNA. She tracked all those federal, state, and city public health policies and procedures throughout all their ups and downs, and shared with the 43,000 registered nurses who work statewide in New York on hospital front lines. Last but certainly not least on our virtual panel today, Allison Fazio, a first grade teacher in Public School 110 in Greenpoint, Brooklyn. Ms. Fazio is her school's chapter leader for the United Federation of Teachers, or UFT. She's been teaching for 25 years. So let me thank you all. I mean, I don't even know how really to thank you for what you've done. All those nights of nightly cheering the nurses have begun to seem a long time ago and inadequate to the amount of gratitude that people like myself share to to people like you. I want to start by getting just a little sense of where you are right here, right now. We're marking a kind of anniversary, but it's an anniversary that takes us back to some really rough times and some really misguided messaging from both the federal government and also state and even local and local administrators. So let me start with you, Terrence. Going back a year ago, you were being told by the MTA, the Metropolitan Transit Authority, not to wear masks, at least not on the job. That's changed, obviously, but as you sit here today, what stands out for you in the experience of the last year, Terrence?
Well, it's a staggering loss of life. Many of my colleagues, many of my union sisters and brothers have perished. That number has grown from 134 upwards to 150. And that's just for local 100. I don't even know what the count is for the national union, for TWU International. But just here in New York City, we've lost upwards or close to 150 of our members, more than any other uniformed agency, and more than some of them combined. And so it's been devastating to see people that we were once chatting with in the locker room, and then the next week they're not there, and compounded by the fact that we had no idea really of what we were dealing with, and to some degree still don't.
Give us an example. Is there one person who you particularly miss on the job?
Yes, a co-worker of mine, Brother Cyrus, a very mild-mannered, industrious, hardworking gentleman who could often be found in the locker room, resting or reading a book. We had heard that he was sick. He had been out ill for a few days. And then the next thing you know, we hear that he's gone. And then we heard that it was from COVID-19. And he was, in fact, the second transit worker to die from COVID-19. And that was just inconceivable, that someone who was here and appeared to be healthy didn't have any prevailing illnesses that we were aware of. And then the next thing you know, he's gone from a disease that we know little to nothing about, that we're not getting any real direction in terms of how to combat or deal with. And so it inflicted a great degree of terror among our ranks,
Yeah.
and a huge and a profound loss.
Allison, I'm sure you've got lots of similar stories. Where are you today as you look back over the last 12 months? What are you thinking about?
I mean, I think as we all are, we're so reflective, you know, in our personal lives, in our professional lives, in our lives as being a, you know, a New York City citizen. When I think back to a year ago, I remember, you know, all the uproar about not closing schools right away, and you know, the mayor then eventually shutting the schools down, and then teachers had to still go in, you know, to learn about this thing called Google Classroom that we didn't know about, you know, and this now is our lifeline for teaching virtually. And I remember sitting with my colleagues unmasked, you know, socially distanced somewhat, you know, but we needed each other's support, trying to figure out, you know, how are we going to do this? And literally it was a crash course in a day on what Google Classroom is, you know, and thinking, oh, this is only going to be for a few weeks. I mean, I think that's one of the things that really still flabbergasts me, how little we knew then, you know, and how unprepared we were. I feel incredibly proud of my school, of my colleagues, of all of the teachers in New York City, and I have to say, and the families and the parents and the children, because it really has been a collective effort to come this far, and it hasn't certainly been easy, you know, especially now, back and forth, and are we closed, are we not closed, who's quarantined, who's not quarantined. I'm actually currently quarantined, and I go back tomorrow. So it's just been this, what my principal says, we have to be nimble.
Yeah.
And that certainly hasn't been easy. I feel positive, you know, moving forward, finally.
Well, that's what we're about right now today is how do we move forward? But before we do, I want to come to you, Lisa. I mean, Allison talked about collective, collaborative effort. Nowhere was that more obvious than in our hospitals. COVID-19 was not a problem that you could solve through high-priced or fancy surgery and one day out the other. It is really something that requires a lot of nursing. And yet we still see nursing patient ratios not what they need to be. I don't suppose we've solved our problem of PPE just yet. How far have we come? When you look over the last year, Lisa, what stands out to you?
How far have we come? Not far enough. And not as far as we could be right now, without question. Certainly, this was a situation that we had never faced before, but there have been warnings for many, many years. There have been reports written as long ago as 2006 in New York City, New York State, and at the federal level about the need to prepare for a pandemic. At that time, it was expected it would be a form of influenza, but the things that were written in these reports and the findings and recommendations were exactly appropriate to what is occurring today, but they were never followed. And the simple answer for that is money. We have a healthcare system that generally is for profit. We have a situation where budgets are cut to a degree where it's very, very difficult, particularly for safety net hospitals and public sector hospitals, to pay for things that might be needed in the future versus paying for things that are desperately needed today. And we were warned, but unprepared. The effect on the public was obvious. The effect on healthcare workers has been devastating, both physically and mentally.
I hear all of you being, you know, very well behaved here on this television program, but I'll tell you, just listening to you, I'm furious. I'm furious you had to go through what you had to go through. I'm furious that you lost the people that you lost. Terrence, you lost your dad to this disease. Talk about that. And where are you putting the anger about what's happened? Granted, it
Um,
was, nobody brought the disease to our country, but
I try to temper my resentment with what should have been done as opposed to what wasn't done early on by the powers that be. And I try not to conflate my grief about my dad with some of the issues that we faced as a local in terms of trying to protect and insulate ourselves from dying and becoming sick from this disease. To the degree that it has impacted me mentally and emotionally, I found it necessary to start receiving therapy, grief counseling very soon after my father passed, and have enlisted the help of my union to help my members also pursue that, because I believe that there's going to be a good degree of PTSD coming out of this situation. My father, he became ill. We were talking, I couldn't visit him. And then all of a sudden he became so ill that he had to be hospitalized. And then I entered in what is just a very morbid, obscene, it was something out of an apocalyptic movie. You couldn't go to the hospital and visit with him. He wasn't really in a position to hold the phone or be able to speak. And a kind nurse one of that cadre of nurses that came up from the South to help out, because we were so understaffed and so overwhelmed in our hospitals, was kind enough to put a phone by his ear so that he could at least hear my siblings and I speak to him. And but at the next day he was gone.
Yeah.
And I don't know, it's just an unspeakable tragedy, and something that no one was prepared for it. We should have been, as Lisa alluded, we should have been prepared, but no one was. No one really knew what to do. But then there were some decisions that were made in hindsight that were just very poor.
Yeah.
And I think that contributed to everything that it eventually devolved to be.
Yeah. Allison, what difference in all of this has your union made, and what perhaps responsibilities, good, bad, and otherwise, have you had as a union rep there in your school?
It was quite a challenging for everyone, for teachers. It was quite a challenging, and that's such an understatement, for the lack of a better word. And then as the union representative, we worked really hard all through the summer, countless meetings and on my school leadership team, and countless meetings with our district rep and with Michael Mulgrew, and really trying to pressure the DOE to make the right decisions, to come into an agreement about how we could successfully open up safely the schools. Yeah. And it was a lot of work. It was safety walkthroughs and checklists and making sure that we had the PPE and all of those things. I really do feel proud that the union really, stood really strong with non-negotiables, that were testing, for example, the testing procedures that had to be in place in order for us to open safely. And I do believe that without that, it would have been a disaster. It really would have been a disaster. So I think that the UFT really did support our teachers. They really wanted, and our students and our families, to be able to open successfully, and we now have junior high schools open and high schools reopening. It's been a long, hard road to get to that. But, we're finally reaching, hopefully, that point that we can begin to move forward, because, to talk about, yes, has there been learning loss? I mean, that's an understatement, but it's really the social emotional needs of our children and our families that are paramount at this point, in my opinion.
Well, we'll talk more about what comes next for sure. But before we do, Lisa, to you, I actually got my first, I'm talking to you from upstate New York, and I found my way to Binghamton and was able to get vaccinated. I fell into a criteria, and I was vaccinated by a wonderful, lovely, longtime nurse. She's been 12 years in the business. I asked her, had she been vaccinated? And she said, no, she wasn't getting vaccinated because she understood it did something to your DNA and she still wanted to have children. I said you're saying that to me as you're putting the vaccine in my arm. I've beyond having kids, don't want to have any kids. It's all fine. But people still have anxieties and concerns out there. And she's just one of 2 nurses I've spoken to in the last few days who's not getting vaccinated. I've seen statistics as high as 40%. What is the reality when it comes to vaccine hesitancy, even among the nursing staff? And what are your fears right now as much of the country's spirit seems to be rising? Nonetheless, we have the variant out there, and I bet still not enough good masks for people.
The city, state, and federal government have a long way to go in reaching out to communities, whether they be worker communities or communities where people live, to provide information to explain the facts of the disease, answer their specific questions, and explain why, for example, these vaccines do not present a risk to DNA. Talk to women who either are pregnant or might become pregnant, people who are immunocompromised, people who are concerned, because of a history in this country of racial prejudice in the medical community. And that has not happened in as organized a way as it could be. Unions are one of the sources of that kind of information for our members.
So I think we're hearing some of what comes next, a whole lot more education, but there's much more to come. Let's take a quick break for a word from the School of Labor and Urban Studies here at CUNY, and we'll come back with our conversation about what next, COVID-19 essential workers and us. Stay tuned.
The CUNY School of Labor and Urban Studies is the 25th and newest school under the CUNY umbrella. Dedicated to public service and social justice, the CUNY School of Labor and Urban Studies offers undergraduate and graduate degrees in the areas of labor studies and urban studies, and certificate programs in labor relations, public administration and public policy, healthcare policy and administration, and community leadership. We pride ourselves on being an institution that brings together activists and academics. Find out more at slu.cuny.edu.
All right, we're back. You're watching CityWorks, and we're talking about what next for New York and other urban areas, for essential workers especially. And let's start with you, Lisa Baum. You are a public health official, expert who's been working with the New York State Nurses Association, NYSNA, among others. Do you have a clear kind of set of demands or just needs, wants, and desires from different levels of government going forward? How are you answering that what's next question?
We absolutely do. And in fact, healthcare unions and unions who represent workers in other high-risk industries have been meeting regularly, speaking with each other, speaking with federal officials, state and city officials, about the science and what the science tells us about transmission of COVID-19. We know that we still do not have adequate controls in place for airborne transmission of the disease. And this does not matter whether you're in a healthcare setting or on a bus or in a school or in a grocery store. What we need to see from the CDC and OSHA, from the state DOH and city DOH, are guidelines and requirements for employers and for the public that protect them from airborne exposure. Studies have shown since the disease was back in China that there is a high risk of transmission through airborne exposure. And even with the new CDC administration under Biden, we are still not seeing a transition to guidelines that put in place appropriate requirements for PPE, ventilation, et cetera, to protect workers.
And what about you, Terrence, at the Transit Workers Union? You're a bus driver in New York City. What do you believe your fellow workers need, and are you getting it?
Well, we waged a very ferocious battle against the authority, MTA authority, to put in place the measures that we thought would protect us to the degree possible. So we've had hard slider COVID partitions placed on the operator's compartment in buses. Of course, there's the overnight cleaning of trains and buses, and every train and bus must be cleaned at least once every 24 hours. We've had new jobs created where we have operators at certain terminals and relief points that are cleaning out the operator's compartment or wiping it down with disinfectant in order to prevent cross transmission between operators. We have lobbied for the installation of MERV filters in the buses, which I understand they have started installing these different kinds of higher rating MERV filters in buses in order to cut down the amount of particulate as well as pathogens of any kind that are in the cabin as we operate. And as we see a need, we will continue to fight or hopefully negotiate what we need in order to make sure that we're going to be safe. We are just not going to tolerate. We're not going to tolerate any more decision making that lends itself to our demise. That is entirely unacceptable.
You think it's changed the union, what you've been through?
I don't think it's changed the union. I mean, TWU Local 100 has always been a militant local. And if anything, it's just fired up our furnace even to blaze even higher because we are still not quite past the resentment. I don't think we'll ever be that we felt in the beginning a year ago when we were told that we couldn't wear or use PPE. We couldn't have masks because they were inconsistent with the uniform, that we couldn't wear gloves because they weren't issued. And even as the management dispatched the administrative and managerial staff from 2 Broadway to work from home, we were still being asked to go on buses and work without any protection whatsoever. And the resentment still lingers with many members. And so that's why we are intransigent when it comes to our well-being and what we need to be able to be safe. And as we continue to learn more about this disease, particularly airborne transmission, we're going to be on top of it. And if we think we need more in order to make sure that we can operate safely, we're not asking, we're demanding.
Yeah. What about the teachers, Allison?
Absolutely. To piggyback on that, the UFT is not going to, just because there's an outcry, right, for kids to be back in school, as we know they should be, they're not going to just sit down and let things happen without the proper conversations and based on what the CDC says. So for example, hearing right now that the CDC, there's conversations about instead of the 6 feet social distance, the 3 feet social distance, which would be a huge game changer. I mean, our children are masked, they are social distanced, but that's a huge game changer. And not to say that I think anyone isn't thinking like, well, that's a positive step, but they're not just going to sit down and just say, oh, sure, let's go. It's going to be a conversation. It's going to, between, the DOE and the UFT and, hard conversations and really based on the science. I mean, that's what it comes down to, based on the science. If this is what the CDC is saying and this is what the science is saying, then I think that is what will happen.
Thank you. Lisa, back to you for a second. I mean, you mentioned, we've got a change of administration, change of personnel. What difference is that making? And can you illustrate a difference that you're experiencing as you gather information to share it with NISNA and its members?
Well, we see obviously a difference in ability to access vaccines, and that has been sped up, which has been good. We have seen more action in a change in mentality at OSHA. So they are being more aggressive about following up on complaints. They have received approximately 70,000 complaints related to COVID, have done almost no on-site inspections, closed many of them without full investigation. That is changing. We do expect OSHA to issue a COVID temporary emergency standard for COVID, which we hope will cover things like airborne exposure and the requirement for effective controls. Where we have been disappointed has been in the area of the CDC, where we have not seeing them come on board with the science related to transmission of COVID-19. So we do have more of an ear. They are listening now to worker stakeholders, which was much more difficult under the previous administration, but we still have a significant fight ahead of us.
Sounds like we all have work cut out for us, but as we are the survivors of this particular challenge, we mourn the missing and work like heck for the living. So thank you. We will be together in the struggle. And I really appreciate you taking part in this conversation today. I want to thank Terrence Lane, New York City bus driver, shop steward with the Transit Workers Union Local 100. Allison Fazio, first grade teacher out there in Greenpoint at New York City Public School 110, and a part of the chapter of UFT out there, and health and safety expert Lisa Baum with the New York State Nurses Association, NYSNA. For comments and questions, you can email us. That's cityworks@slu.cuny.edu. Until the next time, for CityWorks, I'm Laura Flanders.